body through energetic fields. Not only that, it communicates with others. Not only that, you know, the Earth is moving in the orbit, creating also electromagnetic field.
Exactly.
We proved through the conference that we have the same frequencies, our hearts have the same frequencies of the orbit when we are coherent, when we are in relaxation mode.
Wow.
But when we are angry, we are much away from that.
When we're stressed.
Yeah, and the Earth is affecting us, and we are as groups affecting the Earth.
Wow, this is really some groundbreaking discoveries that
It's groundbreaking, yeah.
Absolutely. Tell us a little bit more, though, Dr. Abdullah. What else did you come to discover through this conference? I mean, some of the major points. Of course, this is amazing what you're saying, and it sounds, I mean, from a non-scientific perspective, sounds something too good to be true or abnormally true. But tell us something else that you also discovered through this conference, because this is the third international conference, and I'm sure that with every conference there's more knowledge and there's more discoveries when it comes to the world of cardiac science.
I think one of the major calls of the third international conference for advanced cardiac sciences is calling for reviewing our practice in blood pressure measurement.
Thank you for mentioning that.
Yeah.
Yes.
One of the major columns of the conference was Professor Franz Halberg, who was 92 actually, 92
Wow.
years
Mashallah.
of age, and he presented to us for the first time to the Middle East. Actually, most of the guests, they are in the kingdom for the first time in the Middle East.
That's amazing.
Franz Halberg is very well-known and reputable name in the scientific community. Actually, he is the founder of what we call chronobiology. This is the science, the contribution of time in biology.
Okay.
And if we go to this field, it's actually very amazing. But just to summarize what we contribute to blood pressure measurement, we want to tell the medical community worldwide that the office spot check blood pressure measurement is wrong practice. Wrong practice. It is wrong practice. We are seeing our patients once or 3 times or 4 times or even 10 times a year. This is not enough. What we are calling for blood pressure measurement over 1 week, and through this week we will know many variables which contribute to our treatment. You know, major experiments has been done, and it showed clearly that good number of patients who are receiving antihypertensive medications do not need it, and good number of normals need medication.
Okay.
But they're unaware because they haven't been checking regularly enough.
Yeah, actually what we are calling for, measuring blood pressure continuously so that we will know the daytime and nighttime ratio.
Okay.
What we call the circadian hyperamplitude tension. We call it CHAT, circadian hyperamplitude tension. This is overswinging of the blood pressure. This is a major factor which contribute to stroke.
Absolutely, because I was going to mention that, Dr. Abdullah, blood pressure is another silent killer, and it's very common here in the Arab world. It's common in other parts of the world,
worldwide, actually.
But it is common in the Arab part of the world, and I think it's down to, again, lifestyle. I mean, we don't really get, as a society, as an Arab community, we don't really get enough exercise, and exercise is a factor that sometimes can help lower blood pressure and also help to actually get the heart working better.
And obesity also.
And obesity,
especially food as well. The food that we consume.
The lifestyle, when it comes,
really,
food is really important. I mean, the late dinners, the heavy late dinners, as tasty as they may be, this kind of lifestyle all contributes to affecting our heart and also affecting our body in many different ways. And I believe blood pressure or having high blood pressure is one of the contributing factors to heart disease.
It's a major contributing factor.
What did you find with this? I mean, tell us a little bit more about this. What did you find with these experiments?
Actually, we now at this time we are calling for reviewing the way we are measuring blood pressure. Doing one blood pressure measurement and giving medication should not be our practice. You know, if we go to, for example, Saudi Arabia and look for the economy we spend for antihypertensive medications, it is huge. You know, everything is available in our kingdom, thanks God. All the good or the excellent brands, international brands are there. But we need to use our medications properly through proper measurement, through proper diagnosis of patients, and excluding the normals.
Absolutely.
That's absolutely true. I'd like to thank you so much for raising the
Thank you
issue of
very
blood
much.
pressure, sir, because I really think that, as Rasha said, blood pressure is a silent killer, and most of it also increases with stress. I also believe this,
It's
and I think whenever patients go to the hospital, or even let's say make it a routine checkup, for example, to make sure you get your blood pressure checked and your cholesterol level checked. This is something very important, but very important, sir, that you were mentioning some aspects of groundbreaking, let's say, discoveries.
Yes.
Something very interesting I want to ask you about, sir, is neurocardiology.
Neurocardiology.
This is
True.
something also relatively new in the cardiac field.
It's relatively new, but it's not very new. But now we started discussing neurocardiology in the second conference, and we came to actually something like explosive news in the third meeting.
But what is neurocardiology? Just to give viewers an idea. Sir.
Just the word neuro means a neuron,
Nerves,
and cardiology means heart.
Absolutely.
So we are speaking about brain within the heart.
Wow.
Yes, we
And
are
they're
speaking about
inseparable,
brain
actually.
within the heart.
They're inseparable.
It's actually through the conference we demonstrated how the heart can control all the organs, including the brain,
Absolutely.
through
Absolutely.
the neural connections.
Okay.
I'm not referring to the hormones. We are referring to direct communications, which is actually new discoveries, and which reflect the real status and the honorable status of the human heart.
Wow.
Amazing.
This is, I mean,
Wow.
you know, subhanAllah, this is all very amazing. You know, there's nothing like the human body, of course, we all know this. But Dr. Abdullah, this is the third international conference. How is this conference different from past conferences? Because I believe with every conference comes improvements, comes more efforts, more interest from the medical community. How does this conference actually differ from past conferences that we've
Actually,
had?
we are focusing more on this conference on risk factors. The traditional risk factors in causing heart disease, and when we speak about heart disease, everybody in the if we're speaking in public, everybody will understand the smoking, hypertension, obesity, cholesterol. But we have other types of cardiac diseases. We have the valve disease,
True.
which
Yes.
we call the rheumatic heart disease,
Absolutely.
which is
Absolutely.
fortunately enough, and thanks God, in our kingdom it is just as minimal as in North American
good.
countries. But I think we should focus at this time at congenital causes.
Absolutely.
Congenital causes, those are cardiac malformations we are
Exactly.
born with. So it is the right time to look for the risk factors
Absolutely.
of heart diseases and to review what has been done in the last 50 years. There is a graph which we show in the conference which is actually frightening everybody. Thousands of patients who were evaluated, and in the acute management we have very nice results.
Amazing.
Heart is beating and normal, but in follow-up over 25 years the mortality is the same or increasing.
Really?
True.
Amazing.
And this is a call for review.
Wow.
So this is something...
This is published in international journals.
This
what I
is a
mentioned.
very important point, Dr. Abdullah. I'd like to thank you for bringing this up, because I believe that as a society, as an Arab society, realistically speaking, we don't often visit the doctor unless we're sick.
Yes.
I think we need to go for at least an annual review to make sure that everything's okay, have regular checkups. We only ever go to the doctor, unfortunately, when it's too late, when we have really bad symptoms or when we're extremely ill. But it should be something, it should be a routine where we should actually check to see if everything is okay and everything is functioning properly.
Yeah.
That's very true. And sir, can you give us an idea, for example, let's say, what was the final outcome of the conference itself? Because I believe this conference was very important since it had a
Yes.
lot of international speakers and scientists as well.
Yeah.
So give us a bit of an idea. So what were the outcome? What was the expectation? What were the papers that were presented for research?
Actually, speaking about the topics of the conference, actually we covered 11 topics.
Okay.
But it is not the right time to discuss all the 11 topics, but just to
The main ones.
summarize the main ones. In this conference, we are calling the international community to focus on research of cardiac energy.
Okay, good.
And again, we are calling for major and serious review of risk factors of heart disease. Actually, I forgot to mention one of the major columns of the meeting was Professor Kilmer Macaulay, who is the father of homocysteine.
Okay.
There is an amino acid called